According to an internal report we obtained, the state office responsible for making sure that healthcare facilities are running properly hasn't been running properly itself. Now, we're talking about the Virginia Department of Health's Office of Licensure and Certification, or OLC.
Chaotic, to say the least. Very confusing.
That's how Steve Lambert described his interactions with the OLC, which in part inspects nursing homes for regulatory compliance and investigate complaints submitted by members of the public. He filed one in late 2023, alleging poor care and conditions at the facility his brother lived in.
VDH did not initiate the actual investigation until 8 months following me filing the complaint.
Lambert says OLC then sent him contradictory information about the outcome of the investigation, and he never received clear answers regarding his allegations.
I can't imagine how such a process that they use can be so erratic.
As we previously reported, the short-staffed OLC has struggled to keep up with an increase in complaints and ranks next to last in the country for nursing facilities that are overdue for inspection. All the while, it reports a decline in the overall quality of care. The office is now undergoing leadership changes, with the former director, Kim Beasley, moving into a new role, and VDH focusing on enhanced recruitment and retention efforts of medical facility inspectors.
We know that low staffing has been a factor and a large problem as we look to ensure the appropriate oversight for nursing homes.
And now CBS 6 has obtained this internal report produced in March that sheds light on significant issues within the work environment at OLC. There were some positives, such as strong relationships between staff and supervisors and a commitment to the mission of public health. But there were many weaknesses and threats identified. Here's what the study found. Senior leaders were seen as unapproachable, overly critical, and retaliatory. The office lacks subject matter experts that can support staff. There is no onboarding process, meaning new employees must figure out job responsibilities on their own, and then they're reprimanded for not knowing certain tasks, despite never being trained. The absence of a training manager is impacting inspectors' quality of work. There's a lack of standardized procedures for inspections, leading to inconsistent practices. Facilities and complaints are assigned to inspectors without much consideration. Pay for inspectors is low. Over half of OLC positions are vacant, leading to most functions in the office not running properly. New employees are hired without proper vetting, there's a substantial backlog of work that may take years to address, and there is no formal retention plan in place despite high turnover. In May, Beasley submitted a response setting 5 goals for improvement, and that includes leveraging HR support to reduce vacancies, implementing a preceptor orientation and training plan, increasing employee engagement and satisfaction through culture and communication strategies, reducing the turnover rate to 10%, and removing obstacles that interfere with operations. The State Health Commissioner, Dr. Karen Shelton, previously said that many of these efforts are already underway.
As we have rebuilt their infrastructure throughout our agency and then begin to tackle each of the problems as they come through, we have had a special focus on our nursing homes.
And we should note the staff response rate for this report was about 40%. The goal is to do a reassessment in September with higher participation. VDH declined to answer whether the concerns identified in this study had anything to do with the recent leadership changes within OLC. I'm Tyler Lane for CBS 6 News.